Open enrollment for health insurance in Washington started this morning. Healthcare has been in the news a lot lately, and we know that many of you have questions about what's different this time around. So joining us now in studio is Marchand, Director of Marketing for Washington Health Plan Finder, to help you get some of the questions answered. Good to have you here, Michael.
Thanks for having me.
So the first thing we want people to know is that the enrollment period is a little bit shorter this year, but longer than the federal exchanges. So tell us about that.
So our open enrollment period starts today, goes through January 15th. However, we're encouraging people to take action by December 15th because in doing so, it would allow your coverage to start the first of the year. If you take action after December 15th, between those 15th and January 15th, your coverage wouldn't start till February 1.
What are the biggest changes that people should know about?
I think the biggest changes are, as with every year, is in rates and products that are available. So there's going to be changes in prices, and there's also going to be different kind of insurance plans that are out there. So it's going to be important for people to take a look at what they may need for coverage in 2018 and make sure that they're buying something that meets their needs as well as maybe fits their budget and what their family might need.
You can't just assume that what you had in 2017 will work in 2018.
That is true.
You've got to go through the plans, make sure you pick one that still fits for your family, right?
Right, and also it may be the case as you're going through this that you may find something that better fits your needs, or you might be able to move to a different product that might save you money.
Okay. Anything else that people should know about when they go to the website? Is there any tips on that? Yeah,
so we have a new tool this year called Smart Plan Finder. And Smart Plan Finder lets people put in how frequently they go to the doctor, their prescription medication, maybe what doctor they want to have in their network, and sorts plans by their preferences. And this is really great because it really helps people get down to, the essentials of what they want to get out of their health coverage in 2018.
You had a lot of people enroll last year, more than 200,000 new customers. So what are you expecting this year?
Yeah, we're hopeful that we continue to see that number. We know for a lot of people they're going to be using Health Plan Finder for the first time. We're already seeing just in the first morning a lot of traffic on the website. We're up significantly. I think we're up over 30% from last year at this time, and our call center is very, very busy. So for those who are calling in already, please bear with us. We're handling the volume. But we're expecting to see, hopefully, an increase. People really value insurance, and insurance is important to them because it's good for themselves and good for their family.
This can be overwhelming, this whole process of trying to select a health plan. So a lot of people put it off because they don't want to sit down and have to do that, but it's important to do so. What is the biggest mistake that people make when it comes to this?
I think the biggest mistake people make is they don't come to starting their application or doing it, bringing all the information to the table to start. So there's nothing worse than starting an application and let's say you forget your kid's social security number or something like that you have to fill in order to get people on a plan. That's very difficult. So we're telling people that the willingness to succeed is exceeded only by the willingness to prepare. So come prepared with your information when you come to the website.
Okay. Michael Marchand, thank you very much. We appreciate it. The deadline, once again, to register if you get coverage to start on January 1st is December 15th.
Correct.
Remember that.